The latest milestone in the coronavirus pandemic, and it is a somber one indeed. This year has thrown so many numbers, but still 10,000 is a bleak figure to consider, and 10,000 Canadians have now lost their lives. These are the faces of some of the people who have passed away from COVID-19. They are parents, they are children, brothers, sisters, husbands, wives, all ages, all walks of life. Frontline healthcare workers among them, of course. The human face of this health crisis is something the Prime Minister addressed specifically at his briefing yesterday.
Over the past few days, we've seen record cases of COVID-19 across the country, and it's a cause for concern. Behind each new number is a friend, a parent, a neighbor, or a senior. What we are living through is a horrific national tragedy. Families have lost loved ones, been devastated by these tragedies. And we need to know that there are more tragedies to come.
We'll get to that warning in just a moment, but Michael Serapio joins us now with more on what the Prime Minister said, the horrific national tragedy. Michael, tell us more about this milestone.
Yeah, well, you know, it's easy to focus on the number, but of course behind the numbers, as you were saying, are real lives, and it's hard to really reflect the profound loss that families have experienced these many months as we've been dealing with this pandemic, losing these loved ones in a time of great crisis, oftentimes their loved ones dying alone, scared, with little or no comfort at all. As you said, the Prime Minister calls it a horrific national tragedy. But we are also learning now more details, Heather, because of this first wave. As we enter into the second wave, we are now looking at the numbers, and we now know who this pandemic has hit the most. Take a look at what we know now as we enter the second wave. 80 to 90% of the 10,000 deaths coming from the first wave. More than 70% of deaths have been people over the age of 80, mostly in long-term care homes. More than 90% of those who died were in Ontario and Quebec. And in this second wave, more young people are getting sick, but most of the victims, well, they still remain people over the age of 70. And as the rates of infections go up again, there are fears and concerns of returning to what was, but there are things learned, and perhaps those will offer some positive guideposts in the days and weeks and months ahead. Take a listen to Dr. Prabhat Jha from Toronto's St. Michael's Hospital.
The death rates now in the second wave or the rebound peak are overall lower, and there's fewer of them occurring in the long-term care homes because more precautions are being taken. And what we've also learned is the chains of transmission that really contribute to deaths. The data emerging suggests that most of the infections that occurred and ended up killing in very large numbers people in nursing homes occurred as a result of staff exposure, not so much families visiting.
So, more information now that we did not have in the first wave, so perhaps that will make things better as we go forward. But again, the best way to prevent more deaths is to keep infections down. And right now, as you look at certain provinces across this country, the numbers are actually going in the wrong direction, Heather.
The Prime Minister, even as he delivered that tribute yesterday, Michael, also was looking forward with a warning, too.
Yeah, essentially telling Canadians that this is horrible, what we've been through. But there's still many rough days ahead. In fact, he says it's going to be a very rough winter for many Canadians. Take a listen to what we heard from the Prime Minister during his latest briefing.
We are in an unprecedented global pandemic that really sucks. It's tough going through this second wave. It does mean we have to continually remind ourselves to follow public health advice. But I know Canadians can get through this together. And yes, we've seen rises in cases here and there. We've also seen flattening of the curve in other places. We know we can do this. We've done it before.
Done it before. The hope is that we'll get there again as a country. And if there's anyone out there, Heather, that doubts the seriousness of this, it was really interesting to hear your conversation with Dr. Samir Gupta about 30 minutes ago as he was talking about the trend lines that we have seen in the first wave and the trend lines that we are now tracking in the second wave. Take a listen to Dr. Gupta.
We've done better than the US, we've done better than Sweden, done better than some of the European countries that were hit hard, like Spain and Italy, for example. The concern, however, is that with the second wave, we are tracking some of those European countries. Quite consistently, we follow the same pattern. And if we're not able to get this under control, in a couple of months, we'll be sort of where they are now. And in many cases, they are seeing those resource limitations, that capacity limitation in their hospitals and in their ICUs, similar to what happened with the first wave.
And that is the fear, an overwhelming of the healthcare system, more deaths as a result. And again, the basics of this have not changed. Wearing masks, keeping your physical distance, washing your hands, limiting the number of people everyone is actually interacting with during this era. And yes, public health advisories will change month to month, but the basics do not change. And as we mark this grim milestone, Heather, it's also important that we remember the lives lost, to celebrate what was and to remember what has been a profound impact in so many families. And there is a page that CBC News has been working on, many Canadians being generous, sharing their thoughts, sharing their remembrance on a web page that we've called Lives Remembered. And for people to see that, they can go to cbc.ca/remembered.